Hello, this is Nursing School. My name's is Patrick. Today, we are going to learn about aminoglycoside as antibiotics and anti-infectious agent drugs or medication. Remember to subscribe, like and share. Aminoglycosides. Aminoglycosides are bactericidal. They destroy bacteria. It is broad-spectrum antibiotic when is classified according to working spectrum. They're effective against gram-negative bacilli, some aerobic gram-positive bacteria, mycobacteria, some protozoa. Naming names. Aminoglycosides currently in use include amikacin sulfate, gentamicin sulfate, kanamycin sulfate, neomycin sulfate, neomycin sulfate, paramomycin sulfate, streptomycin sulfate, tobramycin sulfate. Pharmacokinetics, how drugs circulate. Because aminoglycosides are absorbed poorly from the GI tract, they're usually given parenterally except neomycin, which is given orally for preoperative bowel cleansing. After 4 or IM administration, aminoglycoside absorption is rapid and complete. Flowing with extracellular fluid, aminoglycosides are distributed widely in extracellular fluid. They readily cross the placental barrier but don't cross the blood-brain barrier. You're kidneying me. Aminoglycosides aren't metabolized. They're excreted primarily by the kidneys. Pharmacodynamics, how drugs act. Aminoglycosides act as bactericidal drugs against susceptible organisms by binding to the bacteria's 30S subunit, a specific ribosome in the microorganism, thereby interrupting protein synthesis and causing the bacteria to die. Reasons behind resistance. Bacterial resistance to aminoglycosides may be related to failure of the drug to cross the cell membrane, altered binding to ribosomes, destruction of the drug by bacterial enzymes, penetration power provided by penicillin. Some gram-positive enterococci resist aminoglycoside transport across the cell membrane. When penicillin is used with aminoglycoside therapy, the cell wall is altered, allowing the aminoglycoside to penetrate the bacterial cell. In combination therapy, penicillin should be given first. See aminoglycosides, gentamicin. Pharmacotherapeutics, how drugs are used. Aminoglycosides are most useful in treating infections caused by gram-negative bacilli. Serious nosocomial, hospital-acquired infections, such as gram-negative bacteremia, abnormal presence of microorganisms in the bloodstream, peritonitis, inflammation of the peritoneum, the membrane that lines the abdominal cavity, and pneumonia in critically ill patients. Urinary tract infections, UTIs, caused by enteric bacilli that are resistant to less toxic antibacterial drugs, such as penicillins and cephalosporins. Infections of the central nervous system, CNS, and the eye. Treated with local instillation. Aminoglycosides are used in combination with penicillins to treat infections caused by gram-positive organisms, such as staphylococci and enterococci. Combination therapy increases the drug's effectiveness and reduction of dose. Individual aminoglycosides may have their own particular usefulness. Streptomycin is active against many strains of mycobacteria, including Mycobacterium tuberculosis, and against the gram-positive bacteria Nocardia and Erysipelathrix. Amikacin, gentamicin, and tobramycin are active against Acinetobacter, Citrobacter, Enterobacter, Escherichia coli, Klebsiella, Proteus, indole-positive and indole-negative, Providentia, Pseudomonas aeruginosa, and Serratia. Neomycin is given orally to suppress intestinal bacteria before surgery and is active against E. coli infectious diarrhea. Aminoglycosides are inactive against anaerobic bacteria. Drug interactions. Carbenicillin and ticarcillin reduce the effects of amikacin, gentamicin, kanamycin, neomycin, streptomycin, and tobramycin. Side effect. Amikacin, gentamicin, kanamycin, neomycin, streptomycin, and tobramycin administered with neuromuscular blockers increase neuromuscular blockade, resulting in increased muscle relaxation and respiratory distress. Toxicity to the kidneys may result in renal failure and toxicity. to the neurologic system results in peripheral neuropathy with numbness and tingling of the extremities. The risk of renal toxicity also increases when amikacin, gentamicin, kanamycin, or tobramycin is taken with cyclosporine, amphotericin B, or acyclovir. Don't give other potentially nephrotoxic drugs such as vancomycin. Don't use warfarin or neuromuscular blockers. Thank you for following Nursing School. Remember to subscribe, like, and share and comment.